Hello, my name is Dr. Fina Madrid, Yogi DDS, trying to bring a little bit of yoga into the dental field. Today I will explain one of the conditions that is very common in our dental office and how does yoga can help alleviate, decrease, or prevent this condition. Bruxism, also known as grinding. Grinding is particularly done at night in our anxious or stressed out patients. Grinding will wear down the enamel. The enamel is the outermost tissue of our tooth, which is highly inorganic, which is a very strong defense against all the acids and everything that we eat, specifically nowadays. And when this enamel is thinned out or reduced, the dentin, which is the underlying tissue, will get exposed. Once this dentin is exposed, the dentin has more organic material. Hence, we will have sensitivity. Again, this sensitivity can be so great that the quality of life of our patient will be diminished, and it could lead to root canal treatments or other more severe or complicated dental procedures. Another one of the consequences of bruxism or grinding is temporomandibular joint disorder, also known as TMJ, for our patients. Now, TMJ again can also decrease the quality of life of our patients significantly. When we are grinding at night, the temporalis muscle, which is located around here, as all my dental providers know, the temporalis muscle is going to be spastic all night long. In the morning, the patient will wake up with headaches, and sometimes, again, so excruciating that the patient has to take anti-inflammatories, etc. Another of the consequences or symptoms is limited aperture, or you won't be able to open your mouth as wide as it's adequate or is necessary to maintain function. Now, from opening about 4 fingers, which is 40 to 50 millimeters, you'll open about 2 if you have limited aperture, or sometimes even only 1 finger. How is this going to impact our life? It's very uncomfortable. You won't be able to open properly, and you won't even be able to brush adequately, remove plaque, and even then use a dental floss. So some of these conditions, the TMJ disorder, which can lead to headaches, limited aperture. Also, the limited aperture will happen again, if you remember, because of the spasms in the lateral pterygoid and the medial pterygoid muscles. So these two conditions are led by bruxism, and bruxism can be alleviated by diminishing the stress level in our patients. And one of the ways that that can be accomplished is by yoga. So I will put down below the link for some exercises to alleviate TMJ disorder, and some of the citation for evidence-based dentistry and articles that I have researched to support what I'm saying right now. I will explain furthermore in another episode some other ways in which yoga helps the dental provider and the patient. With that being said, thank you and namaste.